Okay, there we are. It's always that moment of beam me up and wait for it to happen. So welcome back, everyone. Thanks for joining us. We are back for another Red Birth Green After Dark conversation. I'm really excited for where we're headed tonight because it's uncharted territory and it can be really uncomfortable for some people to talk about our topic of the evening, which makes me excited to bring it into the light and kind of out from behind closed doors, if you will. So I'm Erica G, director at Red Birth Green, and this is Rowan. Our screen's always backwards. I don't know where to point. Yeah.
You got it the second time.
Okay, there, this way. So our topic for tonight, we're going to step into what it looks like. Well, it's actually, let me back up. It's a bit of a continuation from our discussion last week, if you were with us. We went in and talked more about like the spectrum of gender. And we're talking about these topics this month because it is Women's History Month, and we kind of want to rewrite what that means. And so that means expanding our vocabularies and our understanding and language and whatnot. So the discussion last week was fantastic, and we encourage you to go back and watch that. You can find it in the archives here on Facebook. It also lives on our IGTV over at Red Birth Green on Instagram. So you can catch up with us there. But tonight we are talking about anatomy reimagined and stepping into an expanded view. Last week we expanded our vocab. We're expanding our vocabulary again this week, but we're also expanding our view of what our bodies are made up of and what they're supposed to do. And so we're really excited to do a little bit of chatting and learning and growing. So I know that for some people this can feel really embarrassing. We deal with babies and bodies all the time. And so it's very normal conversation, like dinner table conversation, actually, for us. And we would love to support you in getting to a place where it feels that regular for yourselves as well. So this is the start. If it's uncomfortable, have a seat, get a little red face. It's all good. We're here for it. But mostly just open yourselves up to an opportunity to grow. So yeah, Rowan's got some great images that we're going to share tonight and just kind of riff on conversation. As always, if you have questions, drop them in the comments. We love that. We love that interaction and being able to get that feedback right away. And also for our archive discussions, it's fantastic for the people who catch it later as well, so that we can incorporate that for them. But yeah, let's get into it.
Awesome. So I'm going to share these images here. And just now we're getting ready to see some anatomy images. They're all illustrations.
There we go. Yay, technology. Thanks for coming.
Oh, it worked. Okay. So I'm calling this Female Anatomy Reimagined, and also saying assigned female at birth, kind of calling back to our conversation from last week. It's
hey, Rowan.
Yeah.
Your images are not there yet, and I don't know why.
Oh, interesting. That's good to know. Let's try something different.
There we go.
Yes. Okay, good. Great. All right. So yes, Female Anatomy Reimagined. Assigned female at birth is a way to think about it. And again, usually what somebody is assigned at birth is based on what somebody sees, one person sees from the outside.
Yes.
So we don't really know what's going on inside when we look at a baby, and really when we look at anybody. So this is just the textbook look at female reproductive and sexual anatomy. And there's this really awesome gallery called the Vulva Anatomy, or the Vulva Gallery, and this is the anatomy piece of that. These illustrations are by Hilda Atalanta. This is not We'll get to those in a second. But this is an internal view from the side of the female reproductive system, and this is generally what people are the most familiar with. And you can see the uterus kind of sits up here in between the rectum and the bladder. And it has this little pouch behind it. It's suspended by ligaments. And here you can see the ovary, which kind of wraps around, you'll see in the next image, and is attached to the uterus. And then we have the uterine tube, which a lot of people know as the fallopian tube. And there's a little bit of a reimagining of that right now because some people don't want their internal anatomy named after men.
We should have a whole discussion about that too.
Yeah.
All of the things that are in the reproductive field and the gynecological field that are named after men, that all have to do with traditional female anatomy as we know it. And there's such a disconnect there. My goodness.
Big time. And you'll see some more. I don't have any of the actual like names because I don't have fallopian written here. And there's another image that includes another body part that is named after a man, and I have a different name in there for that too.
Awesome.
But yeah, so this uterus sits here at the top of the vaginal canal. And the cervix is the part of the uterus that is protruding into that canal, and the part that you can see if you look inside with a speculum. It's the part that you might be able to reach with a finger. And on either side of that cervix, there's a little pouch also called the fornix. And that's a happy place for sperm to wait to for an egg to be released at ovulation.
Yes. It is. It's like a little holding cell where like they can hang out and be like, oh, now it's time, and they can all dispense where they need to be.
Yeah.
Yes. So like this image is what I think of when I think back to like reproductive health in elementary school and then again in is school, and pretty much like every anatomy book I've ever seen, right? This is that, or like even like wall charts in doctor's offices, things like that. Like this is so standard in terms of that. And I also want to point out that like with the way that the uterus is situated in between the bladder and the rectum, like this is why when you are growing another human, that you have all of that frequency and that urgency to needing to use the bathroom, because your uterus, like those things just continue to compress, which means that their spaces get smaller and smaller as that baby continues to grow because your uterus is growing. And you have a placenta in there, and you have all of these extra tissues and fluid in that area. And so the discomfort that you feel and like the tendency towards developing hemorrhoids and all of that is because of this cross section that we see here.
Yes. And also to know that like when you're menstruating, it's also swollen and enlarged somewhat, and is pushing. And it also depends like on what position your uterus has, because like I said, it's off, like the sort of textbook range for it would be to sit sort of upright in between these two things, but a lot of people have it kind of flopping over on their bladder or backward on their rectum, and so that can really impact a lot of things with urination and bowel movements in general, digestion, all that. It's really interesting.
No, for sure. And I'm just thinking too, like these are all variations of normal, right? Yes. It doesn't mean anything is wrong with you if your uterus is tilted or anything like that. It's just a variation of normal. It's the same thing I'm thinking too with some of the abnormalities that we might see within those internal structures. Things like ovarian cysts or endometriosis, like anything like that. It's a variation of normal. In those cases, not usually with like the most positive outcomes, because they can come with a lot of pain and other health impacts, right? But again, you're changing those internal structures to accommodate for those things, which doesn't affect only one thing. It doesn't, if you have doesn't just affect your ovary. If you experience endometriosis, it doesn't just affect your uterus.
No, not at all.
All basically touching within this really small area in the body.
Yeah. It's really interesting to just be able to take a look inside and see how these things are situated with each other. There's a lot to learn from that.
For sure.
We get a little look right here at the clitoris, which there's going to be a lot more of that I'll get further into. And then these are sort of like the, Latin textbook names for the labia majora, labia minora, which I also like to use inner lips and outer lips because those names kind of make it sound like one should be bigger than the other, and that's not
necessarily
true. So this is actually my illustration. And the same like that fornix here, these cervical crypts also can house sperm, and they actually make cervical fluid, which is what you might see in your underwear at various parts of your cycle. It's totally normal fluid that a lot of people might know as like discharge, but that's made in here, and it's not something that your body is like trying to get rid of. It totally serves a purpose. It feeds. I don't want to like make it all about what it does for sperm, but it is sperm food. And they can hang out in there again, waiting for an egg. So these are just some sort of names for different parts of the uterus. And then you can see how the ovary is attached and how the uterine tube is attached. And then the fimbriae are not actually attached to the ovary. So when an egg pops out of there, these little finger-like structures kind of suck it into the uterine tube.
Which is the coolest. I will have to see if I can find there's a video that shows it really clearly, like the moment of release and like seeing how it all is like this amazing orchestration of things happening, and the fact that it doesn't generally travel outside of like this little imaginary flow that is existing there is just so fascinating to me.
Yeah, it's kind of magical.
It is magical. We are magical beings.
We are magical, totally. So these are some Vulva Gallery images, and I just am so excited to be sharing these right now. And yeah, so these are vulvas with diverse inner labia as seen from the front. So like I said, that like outer labia and inner labia, or outer lips, inner lips. Some are bigger on the outside, and then smaller on the inside, and some are the other way around. There's just a huge variation, and I can almost promise you that you are 100% normal. And then you can see some other parts, some other internal structures. So we have, the mons pubis, this pubic mound, and then the clitoral hood we can see here and here. And that's actually like the point where the inner lips or the inner labia meet at the top over the clitoris. And this is the glands of the clitoris. There's actually a whole internal structure of the clitoris that we can't see, and that basically nobody learns about in school. It's not in most textbooks, and has only recently been like really studied further, which is not a surprise.
Not a surprise, and also like seriously, right?
Yeah, right.
Which is also another reason why we are having this specific conversation. Yes, which we're going to continue, like kind of the impact of having this conversation when we see you again next week. But we will continue to do things just like this because somebody has to talk about it. Somebody has to educate about it. And we're not seeing that yet. So here we are.
Right. Yeah. We have to like really start at whatever level we can. Like if you are seeing this and you have some friends who've never learned something like this before, just have a conversation with your friends, like this is cool stuff to talk about. I don't know how many people are like hanging out with their friends right now, but so there's this vestibule, the vulvar vestibule, that is more or less like the opening to the vagina. This says vaginal opening underneath here too, but it's, the vestibule is just like this entire area. And then the fourchette is where those lips meet down at the bottom toward the anus. Perineum right in between that area and the anus. And yeah, cool to see some variation. So this is a vulva in a non-aroused and aroused state. So this is the exciting part, getting into some arousal anatomy, which is like the especially hidden stuff. So here we see a vulva in a non-aroused state, and then over here we see it in an aroused state. So everything kind of swells. To use a term that some people like to say, lady boner is a real thing.
It's like, can we come up with something better? And also, it's really, really accurate.
Female erection, no.
Yes, and I would say in comparison to what everyone is super familiar with, right?
Yeah.
Like, yes, our tissues also become engorged, and this is the result. Yes.
Yes. Yeah, and there's like all these different tissues that become engorged that like it's just so cool. I'm so excited to share the rest of these pictures because
it's way more complex. Which
yeah.
is that to me is the part that is the coolest that I think most people don't have any awareness of.
Yeah. I didn't like 2 years ago, honestly. I had no awareness of this. It was so cool to look at like one of the few books available and see this, and now I'm so excited people are just like painting beautiful galleries of this stuff. Like, how cool. So this is the clitoris. This is the whole kit and caboodle. And you can see similarities. Like when we're talking about sexual differentiation, like we were talking about the spectrum of biological sex, like this structure is the same in the beginning as the structure of the penis. It's the same thing, and you can make comparisons between different parts, which is why there's so much variation from person to person in what these parts of the body look like in their size. So there's this body, or the clitoral shaft, some people will call it. And you can see this illustration is really cool because you're seeing this like internal part, but they have this sort of like faint image of the external, what you might see on the outside.
I love this illustration for that reason.
Right? Yeah, and all of them are like this, which is great because it just really can like give you a good idea of how these things are positioned inside of our bodies. So there's the glands, and that's the part that is typically like protruding from the body that you can see. Frenulum, I don't know that I've ever actually seen that on an anatomy image, that label, so that's cool. So there's the crust too, and all of these things I'll show you in some of the next slides. They all swell and engorge with blood during arousal. So they get firmer and bigger and redder, which is exactly why this is like redder and firmer and bigger and engorged, and you can see that. So there's that vaginal opening again, the hymen, the fourchette. So here's the urethral opening, which is what we pee out of, between the clitoral glands and the vaginal opening. It's really tiny. And there's actually this whole tube of erectile tissue surrounding that opening. And it's a spongy sort of erectile tissue. And is also, when people talk about the Gspot and they're saying that it's the back of the clitoris, yes, there are these vestibular bulbs here, the bulbs of the vestibule of the vagina, that opening, which also swell, which is why that opening tends to get tight and like closed when there's arousal. And this is also swelling. And so that spot, like on the front of the vaginal wall, that people will often call the Gspot is both of those things, really. And the purpose of that sponge is to protect the urethra from friction because it doesn't like that. And there's actually another sponge that does the same thing between the vagina, the vaginal canal, and the anus. There's another sponge down there as well. And that's all erectile tissue. So this is why, like, another reason, and I didn't include it in this. So here's all of that in an aroused, erect state. What a cool difference.
Okay, I have to throw this in here because this is fascinating. I'm going to have to do some research. So Kimberly just dropped in the chat that there's a large clearance in a park that you can ride. So I don't remember where, but heard about it on a podcast like 6 years ago and saw videos of women riding it. And now I have to find out what the situation is with this because I think that would be amazing. My guess is that it's not in the US and it's probably somewhere cool in the UK. That would be my guess.
Wow.
Yes, but
yeah.
I'm definitely going to have to look into that.
That's awesome. I love that. That is so cool. Yes. Share with me what you find, or I'm just going to find it myself too. Because
yes, absolutely.
Wow, that's awesome. So yeah, so we have also these glands down here, which are known to many as the Bartholin's glands. There's another name, but we'll call them the vulvovaginal glands, or yes, or the glands of the vestibule works too. And those are the glands that produce some of our arousal fluid. So there's a difference between that fluid and what some people might know as female ejaculate, which, again, there's like very, very little research on this, and it's kind of hard to do the right research on this as far as people who are able to ejaculate with this anatomy in one way or another. And so there's some schools of thought that say that it all comes from the bladder. There's others that say that it comes from the bladder and these periurethral glands. And some people say also that there's a difference in like the types of female arousal fluid and ejaculate that come from the periurethral glands versus the bladder. Very interesting. A small amount of fluid is secreted from these little glands, which here's like a little close-up of those. But there's just all sorts of fluids that our bodies are creating in response to arousal that are coming from all these different places. And a lot of it is protective and pleasurable at the same time. Like, how cool that our bodies.
I was gonna say, again, it's so complex, right? Yeah. Like how, and also like the complexity of how all of these things come together to create this optimal environment that is both protective, like you just said, but can also encourage things like conception and making it easier for that to come to fruition.
Yes.
Yeah, it's such a brilliant system in place.
Right? Again, just magical. So, if there's anything that you, Erica, want me to like go back and look at, I can also exit this screen share and we can chat. Let's
chat it up.
Let's do it. All right.
Awesome. So one, I hope this feels like a teaching tool. Like we talked a little bit last week about how uncomfortable it can be as a parent to introduce concepts like this or have these discussions with your kids, right? And so leverage us, like let us do a little bit of that lifting for you. And you know, I think I also alluded to in the fall, we're going to have a full series of classes available to youth and also to parents. So if you want to send your kids to us because you're like, I would really like to be hands off, please do that. But also if you want to feel more equipped to do it yourself, we want to support you in that as well. And so, you know, it's, again, this is a first step in that, in expanding your language and knowledge so that you can introduce a broader sense of concepts versus just kind of what's out there on the internet, if you will. Um, you have experts in your pocket, so use them. We love that.
Yes. Yeah. There are tools out there. A lot of them are like hard to access, and also like entire curriculums that to share with your kids. Like you can be their teacher of this kind of thing, and there are other people doing it. It's hard right now to find spaces, which is why it's going to be really cool to offer those.
Yes, absolutely. I think, there definitely are. I think the other thing that can be really challenging to find is things that are secularly based,
Yes.
don't have a faith-based or, a faith teaching component to them as well. Because I think sometimes information just needs to be information. Like there doesn't need to be a spin in either direction. It's just facts. Here you
Yeah.
go. Right? It's facts. Here's the information that you need in order to keep yourself healthy and safe. And also so that you can have educated conversations with your friends because
Yes.
I mean, I have multiple youth in my home, and I want them to know the right answers and so that they can be in a group and be like, yeah, that's totally not true, right?
Yes. Big time.
We want to empower them to be like peer educators as well. And so I keep saying this is the first step, but this really is how can you introduce these things in a way that's digestible for them. And again, this can be hands off. Just be like, hey, I watched this cool video. Here you go.
Yeah. Yeah, totally. And being able to talk about it in a way that's like not attached to any like particular way of talking about this, like expecting a conversation about like if we're talking amongst friends and not necessarily with kids, but like conversations about sex with other people, like you can just give this as information for somebody to be able to explore their own body. And I think that's a really, really powerful place to start for youth, for young people, for anybody, is just to know what your body is and maybe what feels good to it, but just what's there.
What are all of these pieces and parts, right? We talked about the complexity. Like that means that there's a lot to know, especially when we're talking about, female anatomy. Like there's a lot going on. So we want to make sure that you know that and you know it in an accurate way. Kimberly dropped in the chat too, talking about our whole lives. And so Rowan actually is an OWL educator, and that is one of the things that we hope to bring this fall, in addition to a curriculum called Everybody Deserves Sex Ed. And that's going to be looking at a couple of different angles as well. And so we're just pulling out all the stops. Yes. I think introducing OWL is a little bit more COVID dependent, just because it really is meant to be done in a group setting and be done in person.
Yeah.
And so this all the time. We're just fingers crossed that can happen. But just know that is something that is on our horizon as soon as it's safe to do so in person with a small group of youth. So we're looking forward to that moment for sure.
Yeah.
So I'm wondering, like, we just talked a lot about how this relates to youth and educating, but I'm also thinking about like adults that I know, including pregnant people who don't know any of the things that we just shared.
Yeah.
None of it, right? And yet you like that whole system worked for you to carry a baby. And so how can someone who is like much farther in life utilize this as a tool to get to know themselves better?
Oh yeah. I mean, the first thing that comes to my mind is get a speculum and a hand mirror, and just like send some love to that part of yourself that like just did all of that work, and start with that. And I mean, what I just shared with all that anatomy too is a really good example of why it takes time to get aroused, first of all, for people with this anatomy. And what I didn't share in that is just like how the nervous system is tied into all of that and how our brains are tied into all of that. And it's so heavily dependent on where our heads are at. But getting to know your body to empower yourself in like the field of pleasure, but also getting to know your body to empower yourself to speak to healthcare professionals about your body, because it's helpful when you know it best, you know? And there's also a lot of disempowerment in that space to say, like, no, I know your body best, right?
Such an excellent point.
And so, like, how cool is it if we can all walk in and say, no, actually, I know that I know my body best. And
yes, think about like being able to elevate the conversation, right? If you know the appropriate terms and you can say, not just like, I'm experiencing pain down there. Be like, no, I'm experiencing pain in this very specific area. And they're going to be like, oh, totally changes the conversation.
yes,
And I want to touch on the nervous system part. Of course, everything that I talk about usually is related to birth and babies, right? And but the nervous system that is right in the area of the perineum, and how like it's one of the reasons why we work so hard to protect the perineum during childbirth, and it is also another reason why we moved away from like standard episiotomies, because you're cutting into that area that is so rich with connective tissue, nerves like galore in that area. And you're actually like when you have an intentional cut, it can go very deep. You can also tear really deep. Like I don't want to, act like that's a easy way out just to tear, because it can be really horrific as well. But a lot happens when you disrupt and interrupt those structures down there and try and have them come back together. That
yeah,
can have those long-term implications when we're talking about things like pleasure anatomy and arousal and feeling comfortable with our bodies again. It's hard enough if you've had a vaginal birth um, or had a pelvic birth to like get back in the saddle again and even connect with that area. So I love the idea of sending love, just like make that heart connection and just send it right on down. Like follow
yeah,
the spine and take your headspace, get out of it, connect with your heart, and just breathe into that entire region. That can be so freeing for people, especially if there's any like history of trauma or sexual abuse, things like that. Just figuring out how to love yourself and make those connections can be life changing.
yeah. And I don't want to like minimize the impact either that trauma can play on
Yes.
like even that connection, you know, because like when we're talking about physical damage and trauma to that area, and especially that perineal area, like it also travels back up that nervous system and into the brain, and it like manifests as trauma that can make it really hard to literally connect in those nerves. Yeah, so being like really slow and gentle and like kind with yourself too is so important. And also I can't have like a conversation about the anatomy that we know about without recognizing that a lot of what we know is because of the white medical male professionals doing experiments and on Black women, and that's like where we have a lot of this information from. And there is a lot of deep trauma embedded in that too, and
Yeah.
I can't minimize that either.
No, absolutely not. I think let's put a pin in that part of it because it's such a large conversation, and I feel
I
like
hesitate to like bring it up because it's really
yes,
huge, and
yes. But I feel like it really resonates with where we're headed next week in talking, and so I want to make sure that we give it ample time and really dig into it, the complexities. And next week, we're actually going to be stepping into why does all of this matter in the context of community, right? Because we're so big on bringing people together and reclaiming the village, as we say. Um, and what does it look like to have a whole slew of educated people being able to pass that knowledge side by side with next generations, and how does that change all of the conversation, which I'm really excited about. But I think we can't even get into that without touching on the history of it all. And so, yeah, let's put a pin there and circle back and just say, pause, and we're going to pick that up. And this is where we'll start next week, is by talking about the historical elements to this. Again, in the context of women's history, it's powerful stuff. And like, it's stuff that a lot of people have no clue about.
Totally.
You know, it comes up a little bit in Black History Month. It'll come up a little bit here and there. But I really want to give it some lip service so that we can start spreading that knowledge as well. So, yeah. I'm looking forward to it. It's so fantastic. And yeah, if you've enjoyed it, share it with your friends. We would love to have them join us as well. Like we said before, this all lives on its Facebook page, so you can go back and find it anytime. You can also pick it up over on Instagram at redbirthgreen under our IGTV. We archive all of these conversations. And so come, enjoy, share, learn, grow, all of those things. And if there's something you really want us to chat about, clearly we're willing to go there.
Yes.
Send us a message on either platform. Come back and throw it in the comments on an old video, and we'll find it, and we'll throw it into our rotation. We're here for that. So until next week, thank you so much. We can't wait to talk more soon.
Thank you.